Welcome. My apologies for starting this off. It would not kick in. I'm so glad we are here. Welcome, everybody. Hi, I'm Jada, founder of Boober. Welcome to Park Slope Parents tonight. So nice to have you all here. I need to change my name for a moment, and I'm just going to let people come in. Welcome, welcome. Hi, I'm Jada, founder of Boober. We are based in Park Slope, dear friends of Park Slope Parents, and been working together for a long time. If you could drop into the chat, let me know that you can hear me, and let me know where you live, specifically in Brooklyn. I know not everybody is actually in Park Slope at this moment, as we've gone a little more virtual in this time. Thank you, Olga in Windsor Terrace. And tell me not only where you live, how pregnant are you? We'd love to know that as well. How many weeks are you, or when are you due? Love for you to all feel like you're sitting here together in community. I hope we're all going to get to meet soon. Some of you might be in the different classes together. So welcome. We've got Olga in Windsor Terrace and Drew in Ditmas Park and Kira, 18 weeks in Carroll Gardens. Olga, due June 30th. Fantastic. Hey, Rachel, Crown Heights, 30 weeks. We've got Elizabeth in Prospect Heights, 35 weeks. Cobble Hill due in July. Hey, Evan, Carroll Gardens due September 21st. Oh, you're welcome, Joanna. Park Slope, 29 weeks. Brenda and Drew in Prospect Heights, and you're 26 weeks. Fantastic. Welcome in the North Slope, due June 30th, Johanna. In case everybody can't see the chats, I'm just reading off for all of you. Hey, Melissa in Fort Greene, due at the end of September. We've got Prospect Heights, 22 weeks. Catherine. Hey, Lily in Bed-Stuy. See, we're all over Brooklyn. It's amazing. Due June 5th, due August 4th. Hey, Savvy, 23 weeks in Prospect Heights. Kim and Grace, Park Slope, 27 weeks. Welcome, welcome. Hey, Lori, 28 weeks in Park Slope. Got Diana in Brooklyn Heights due August 7th. Park Slope, 23 weeks. What an amazing group. My goodness. I'm like, should I keep reading all this? So many. Amazing. Clinton Hill, Borum Hill, Kira and Ron in South Slope. I'm in South Slope at this very moment as well. So Greenwood. Fantastic. Brooklyn Heights. Okay. So tonight is for you guys. I'm going to talk a little bit about myself. I'm going to present on some different topics. And then we are going, I'd really love to hear your questions. I'm going to change my name here so that you have me. And I'm going to put my companies. So, all right. So my name is Jada Shapiro. I'm the founder of Boober and Birthday Presents. Let me tell you a little bit about both companies. You may have heard of, I'm not sure those of you who are, which way you're coming from or how you know us, but Birthday Presents has been here for 18 years. I started it in 2002. I live in South Slope, although I've lived all over the slope and many different places. I have a 13-year-old daughter and 3 stepdaughters, ages 11 to 15. I have been a birth and postpartum doula and lactation counselor for 15 to 18 years, depending on how you look at it in the different categories of how I've worked. I've worked as a birth doula at many hundreds of births. I've been a postpartum doula with lots and lots of families. I've taught thousands and thousands of parents in the classroom, and I am also a lactation counselor. So I've helped many families work on their early latches. And Birthday Presents is known, actually, I'm going to tell you a little bit about the shift. So Boober grew out of Birthday Presents. Boober started a few years ago, grew out of Birthday Presents, where we had been teaching childbirth classes, newborn care classes, all of the different classes we'll talk about to prepare for having a baby. And we'd been based in Park Slope and then teaching all over the city. And Boober really grew out of it because I had so many students they'd have their baby. And, we'd give out a list of lactation consultants and people would have their baby. And then we would get a lot of phone calls and texts after going like, I called all the lactation consultants on the list and I can't find anybody. Can you help? And I was like, this is crazy. And today's day and age, you can get your dog walked on demand. You can get your makeup and hair done on demand, but you can't get the help that you need, that critical need to thrive, in this time. And I was like, this doesn't make sense. So I started giving out my cell phone on a postcard to all of our students. And basically it was like, text this number when you have a baby. And if you need any lactation help, like, we're here for you. I'll come over if you're in my neighborhood, or I know every lactation consultant in the city. So I would text them and match them up to people. Anyway, So Boober was formally born after the tech started rolling in faster than I could keep up with. And whereas we were all about in-person, on-demand lactation consulting same day, over time, before the pandemic, we actually started moving birth and postpartum doulas to Boober because I had offline been matching people to birth and postpartum doula care for about 15 years. And so we brought that into the Boober sphere. And then when the pandemic struck, and everything became virtual. Of course, we pivoted everything Birthday Presents, which is my first company. So I'll just type that into the chat. Birthday Presents, which had been teaching all of the classes. So if you guys are on Park Slope Parents and you see reviews for Birthday Presents, I want you to know that all of those classes have moved to Boober. So we moved all of the parent classes to Boober, and now Birthday Presents is for training. We train birth doulas, postpartum doulas, lactation counselors, and some of you who end up deciding to become birth doulas. We've had a lot of parents in the neighborhood, not a lot, but a small amount of people after they have their babies decide to come train with us. So we are still around, but Boober now is doing everything for parents. So we're a platform where expectant parents and new families can find all of their classes and care providers. I will be dropping in the chat a little bit later a code tonight for all of the classes that we do. So tonight, my purpose, my goal with you and with my relationship with Park Slope Parents, which is long and lovely, and what an amazing resource in whatever neighborhood you're in Brooklyn. It's just such an incredible resource and way to connect with expectant and new parents. So my goal tonight is to talk a little bit about preparing for birth and postpartum. And I'll talk a little bit about childbirth education, birth, things to think about, postpartum, things to think about, lactation, things to think about. And then I really want to field your questions. So you can drop your questions. There's a question box. You can drop in the chat if it's something I'm talking about. But sometimes when lots of questions start flying, it's easier to keep track of them if you drop them into the question. And so I'm also just going to throw up this little poll here while I'm pulling up my info, just so we have clarity on where you are in your pregnancy. It's always kind of great to see and hear it where you are. So thank you. So let's talk first about preparing for birth, right? So at Boober, we also have a lot of different kinds of classes. So I'm going to talk a little bit about why you might want to consider childbirth education at all. And you don't have to take a class. We have classes in lots of different formats. I do think that the purpose of taking a childbirth class is to help you feel more confident, more prepared to learn what your choices and options are. So it's really important to me. And I will start by saying at Boober, we're all about meeting parents where they are. There's no judgment, right? So we're not going to tell you how to give birth or why to give birth in a particular place or whether you should have pain medication or not. But my goal is to really talk to you about, inform you about all of your choices and options. So teach you about what happens in labor, tell you what looks normal, how do you know that it's okay, that you might be on all fours making wild sounds, and that's totally normal and fine, right? So we're going to talk about different ways we labor. And childbirth class is also really helpful for learning different pain relief techniques, right? So that'd be one thing. So we have a class that comes in either a 3-hour format or 4 2-hour sessions in Zoom land right now. Now I am curious, and I realized I don't know if I put this in our poll. So I would love to know in the chat, those of you guys are the perfect due dates to ask this question. Would you be more interested in coming to a childbirth virtually, or are people starting to feel comfortable about coming back in space? So that is one question. We had a space on 8th Avenue and First Street. We left that at the beginning of the pandemic, and we've been teaching all virtually. Our childbirth classes are live and interactive. Ooh, IRL. Okay, I'm very curious. Like, you guys are literally my sample. Okay, good to know. Good to know. Yeah, keep it coming because I will be reporting this back. We're looking into it. So that's interesting, but we are always going to keep our online classes too. So what's cool about our online is that you can do these drop-in classes. So we do pain coping classes where you can just hone in on 1-hour-long pain coping skills, from breathing to mental distraction techniques to, I'm going to give you a concept as well. So I'm going to show you a pain relief technique here. I want you to leave here tonight knowing you don't have to purchase any more classes and you still got some knowledge, I hope. So You're not going to do this right now, unless is anybody past 37 weeks. If you're past 37 weeks, you're allowed. Otherwise, please do not try this right now. But this is called the Hoku point, or the headache spot, or it is used often in Chinese medicine and acupuncture. But this is a pressure point that is very helpful as a pain relief technique in labor. And if you are sitting with a partner, if you have a partner at home, you can try it on your non-pregnant partner if the partner is not carrying a baby, but please do not do this if you are before 37 weeks, because it could stimulate labor, possibly. Not like we really have a button where you can just make that happen, of course, but this point works on what we call the gate control, theory of pain. Some people talk about this concept, or the idea that if I'm creating significant stimulation here, then all of the sensation I'm feeling from my cervix, when my cervix is opening during labor, and that's where most people feel the intensity of a contraction, I'm now adding another layer of stimulation or pain or sensation or discomfort. It's not super comfortable. Some people may be familiar with this, using it for the headache. And it actually, for many people, cuts down this significantly cuts down the sensation of pain or discomfort. So I might squeeze this really intensely, maybe even on both sides, for a person in labor when they're having a contraction. And as a doula, I will first try that on you and say, can I try this? If I think it would be helpful in that moment. And all I'm looking for is, a yes or no that you like it or don't like it, right? But we'll try it and see. And for some people, it is so helpful that they will literally put their hand like this when the contraction comes on. So partners, if you are there, or if those of you who decide to work with a doula, you may decide that that's something that you'd want to try, right? So that's something we talk about in childbirth class. We introduce you to a lot of different pain coping techniques. Now, the 3-hour session, which is live interactive, you'd see each other and be able to talk with the instructor. That is a fast and furious. It just kind of goes over a lot to think about, right? You're going to learn all of medical intervention in birth, right? Why would it be used? And when is it appropriate to you? And when is it just being used as a routine? So we talk about water breaking. We talk about, or breaking the water for you, how we monitor the baby. Those of you who are in a hospital will be monitored on what's called an electronic fetal monitor, which you plug into and has 6 feet of cord. But did you know you can still move? You can stand, you can walk, if somebody tells you that. And if you're in a birthing center or at a home birth, you will have a more intermittent monitoring, which comes and goes with what's called a Doppler, right? And they'll listen to the heartbeat and you'll be able to move around a little bit more freely. But we talk a lot about, if you are in a hospital, right, and being monitored, how can you work with that best? Because we know that freedom of movement is one of the things that can really advance and facilitate labor, and is something to consider whether you're somebody who's having pain medication or not. And there's lots of positions that you can use. And in fact, today, like if you want to pull out your phone, I don't know if you are on Instagram, you can follow us at @Boober. You will see we do a ton of teaching tips there. Like today, I'm doing a teaching tip video. It should be, I don't know if it's up yet or not, but about the peanut ball. So the peanut ball, I'll go grab it in a minute. The peanut ball is something that if you have an epidural, for instance, you can still open your legs in such a way that we can see shorter labor and we can see less cesarean birth, to the point where some hospitals have actually started providing the peanut ball so that you can keep your hips open while you're in labor. Really interesting, right? So childbirth class essentially helps you hone in on all of your choices and options, how to ask the right questions in labor, how to feel more confident in birth, how to avoid an unnecessary cesarean birth or know when it is necessary. What questions do I ask? Our 2-hour class is a longer, more luxurious class where you do 4 2-hour sessions. You really get to know the people more, talk, interact, more time for pain technique practice. Whereas the 3-hour, you don't practice the pain relief techniques as much, you're told about them. And then a lot of people like to drop into our pain relief classes. So the pain coping classes are an hour long and they're $15 drop in. I'm going to give you guys all a 30% off for tonight. If anybody's ready to book a class, that 30% off is good through the end of the night, but that's just our general website if you want to see it. All right. So let's talk a little bit about birth doulas. Is anybody out there thinking about a birth doula? You might have some questions around it. So I always get a lot of questions. I'm going to start talking a little bit about birth doulas and why you might want one. Birth doulas are the only childbirth professionals who are actually solely devoted to the laboring person and their partner, if there is one. Birth doulas are trained to provide emotional, physical, and informational support to the birthing person and their partner. And we are the only people who are there entirely, the entire time, really, where most of the time, if you have a doctor or a midwife, they come and go. They often are on shifts, depends who you're working with. They do not stay continuously throughout the entire time necessarily. If you are working in a hospital, studies show that you'll have your OB, if you have an OB, typically around 5% of the time. And I would say that's consistent with my experience over the years. It's a very small amount of time. Nurses in and out, so they might be there 20 to 25% of the time. And it's interesting to start to note that much of the time you'd be left alone. And in COVID times, people are even more alone because they're doing less in and out. Now things are getting a little different, obviously, as vaccinations become more widespread here. So that kind of changes the landscape a little bit. But it is important to think about, like, otherwise we would be solo. So a lot of people like working with a birth doula because a birth doula is there continuously throughout the entire time. So we come to your home in labor, as long as you're not having a super crazy fast labor. And if you are, then you would let us know and we would meet you at the place of birth. But if you are, if you're planning to give birth in a hospital, then a doula can really make a big difference in that. That's great. You can drop your doula questions in the chat and I'll answer that. If you work with a doula, they typically will join you at home and stay with you continuously throughout the whole process. Now, that can mean 4 hours, 8 hours, or 30 hours or more. I'm sure you've heard that labor can be longer for some people. So that we don't trade shifts unless it gets really, really long, like past 30 hours, then you probably do want a fresh doula. And doulas provide physical techniques, like I said. So all of the stuff you'll learn about in childbirth class, the doula has in their head often. And even a new doula who's just come out of a doula training, has just learned a wide variety of techniques to help you cope through labor. So doulas will bring different things to try, right? We try physical techniques. We try from counter pressure, where we press on your lower back, or double hip squeeze, where we squeeze your hips and relieve some of the pain of labor. Or we will try smoothing techniques, right? Where we'll play with your hair. And we'll find out, of course, if you like this or not ahead of time. We'll talk about that. We will also try emotional techniques, right? Where we can provide reassurance and support. Doulas are amazing at being able to say, this is normal, you're okay. Like, a lot of what I do is I show up at somebody's house and they might be freaking out a little because they're on all fours and they're rocking back and forth and they're making these wild sounds. And their partner is like, I don't know, are you okay, babe? Like, right? And I walk in and I'm like, oh, that's great. I love how you're rocking there, right? And then because I'm not panicked and I've seen a lot of births, you're able to be like, okay, I guess this is normal. So that's a lot of what we do, is provide reassurance that this is normal, right? We help you get to the place of birth if you're not having a home birth. So if you're going to the birth center or a hospital, like, we join you and help get in the car and get your stuff and continue to provide comfort, relief along the way. We talk sometimes, we use our voice, right? So if you come to one of my classes that I do a movements and positions class, just an hour on that. I do one that's breathing techniques and guided visualization. So we might be talking you to a special place or the forest or the beach or whatever. We would have discussed this ahead of time to know if that's something that you would like, or maybe I'm just helping you relax your shoulders or helping you find that really deep, low, slow breath. Maybe I'm doing like a guided, here's one great breathing technique is you can do follow my hand breathing, right? So I might look you in the eye and go, okay, take a deep breath in. Right? And I've given you a focal point, something to look at, stare at, think about, you watch my hand. And with that, I'm also helping you breathe in more deeply, bringing oxygen to your baby and letting it out, right? And so it's almost like I'm able to coach you, or I or partners can do this. Deep eye contact often grounds us. And maybe you don't want to be touched and maybe you don't want to be talked to. So I back up, but I can still breathe with you. And anytime we're feeling a little panicked or worried, we might tend to breathe faster and more shallow, right? In a way that's not oxygenating as much and is not as calming. And so if partners who are here or your doula is able to say, you know what, just take a big deep breath with me. And that often grounds us. All right. So doulas typically, doulas work in a wide variety of prices, but let me talk a little bit about the package and then I'll answer that question. I'm also going to drop, I want to let you know we're also having a special on birth doulas right now. So if you do book a birth doula through Boober, you will also get a $45 credit on classes that you can apply to any future class. So just to let you know. So Erin, you have a good question. And Erica has a question too. Erica asked the question, what happens on the off chance your doula isn't available during delivery? Absolutely wonderful question. All doulas work with backup doulas. Everybody should have a backup and something that should be freely talked about. So you want to ask that question directly to us. So like I just dropped that birth doula form. If you fill out that form, what is going to happen if you select concierge, then that means a real live care connector at Boober is going to call you back. We're going to talk to you and they're going to, you'll make an appointment and we'll call and talk to you and kind of find out what do you want in a doula, what's important to you in a doula, et cetera. Like how you may have no idea, but we're going to try and get a sense of you and who the best fit would be based on your budget and based on what you're looking for and based on, what things you talk to us about, what would make a doula most relatable to you, if there's any factors. And then we're going to send you some profiles of doulas and then you'll talk to the doulas directly to start to interview and get a vibe and a fit and a feel. And that's one of the questions you're going to want to ask the doula is how do you work with backup? So it's very rare. I mean, I have not had to send very many backups in the years that I've worked. I have been the backup maybe, 5 times for people. And it's always been amazing, even though I've never, in many cases, I hadn't met the couple at all because, you always try to send somebody who's equally experienced or more experienced and is a loving, caring person who knows how to connect with people. So, I think you always want your doula to have a backup because you wouldn't want your doula to be sick. Like what if they have a stomach bug that night? You absolutely wouldn't want them taking care of you. So yeah, you just want to talk to them and they will have the right kind of, they'll have backups that they work with. You can ask if you really want to meet the backup. That's sometimes possible. They may work with a group of backups. And maybe would want to wait until they're closer to the due date, or you could meet somebody or 2 people sometimes. Most people, I would say, do not meet the backup because we don't know necessarily of my pool of amazing backup people who's the right one at that right moment, right? So when should you secure a doula and how early in pregnancy do people usually look? So that's a great question. I would say that people start looking around between 20 and 30 weeks is really common to start looking. We certainly, just so you guys know, we do get people who will ask us, hey, I'm due tomorrow. I'm not kidding. And I decided I want a doula. I'm freaking out. Very common to get people at the very end. I'm going to say that you'll have a much greater option if you go earlier of people. We will always be able to match and connect you to somebody great. And if we can't, we'll still put you on, we'll try to find somebody for you, even if they're not on our platform. But yeah, I would say start looking around between 20 and 30 weeks. Now, if you got those of you who are due, I'm like looking at due dates. Let's see. Oh yeah. Rita, you have twins. I missed that. Okay, so that's good to know. So Rita, you would want to go a little bit earlier, right? Because we would consider full term closer to that 35 or 6 week mark. And so you'd want to ideally meet somebody a bit earlier, start to connect to people. Now, in terms of, what was I going to say? Sorry, I was just thinking. In terms of when you meet doulas and you interview them, you might know right away, like there's a vibe and a fit. That's what I'd say. Interview at least a few people. You will know pretty quickly. A lot of people are doing an initial virtual visit like this, right? Do a Zoom chat so you don't waste each other's time meeting in person. Or if you do live nearby, you can do a meeting in person, but it's a vibe. you will very quickly know whether or not they feel like a good fit. And so you can ask them things like, how much experience, right, do you have? Why did you become a doula? We actually have on our blog an article that's about to get posted about this, but I don't think it's up yet. Why did you become a doula? What do you like about the work? How would you work with me? What if I decided to have an epidural? Or what if I decided I absolutely don't want to have pain medication? Or what if I decided I wanted you to step out of the room? You want to ask kind of just general questions, right? About, we want to feel like we're supported no matter what. A doula should be really non-judgmental and be able to support you no matter what. What if, just questions like that, I would say, you can talk to people's references, right? But you really want, I need to figure out, oh, that's why I hit the wrong button before. You want to figure out that fit and that vibe, and then feel free to talk to people that they've worked with if you like, unless they're brand new. A lot of you might decide you want to work with a brand new doula. We're constantly training doulas, and so there are amazing doulas in training who are trying to get certified and might be charging very low rates in exchange for that, for your evaluation. Give me some other doula questions that you have. Let me see if I will put up at the end a little bit of an article or two that we've written on our blog, because I think that can be super helpful, to start thinking about, like, why do I want a doula? But let me tell you a few cool facts about doulas. Working with a doula, the studies show, lowers your risk of cesarean birth. We see less cesarean births with doulas. We see less pain medication requests. So if you're a person out there who really is hoping to avoid an epidural, then I would strongly urge you to work with a doula who's going to help you manage your pain in other ways, and who's going to really be able to help you go that distance. But doulas are for people having epidurals as well. They're also for people scheduling cesarean births. We will help you we were there for you. We will help you do whatever it is you need to do, right? Anybody, no matter what, should be allowed to have a doula. So doulas also decrease the likelihood of the risk of postpartum depression. They increase the likelihood of feeling satisfied with your birth experience. They increase the likelihood of successful lactation. So a lot of fantastic reasons to use a birth doula. I really urge you to at least fill out our form, meet some doulas, and see how it feels. You don't have to do it in the end. You can ask. If any of you have not had I don't know if you're doing baby showers or anything like that, or getting gifts on the way, but consider not registering, but asking people for gift cards. You can get gift cards to Boober, which can pay for your childbirth classes. You can put it toward doula care. You can put it toward a lactation consultant, which is awesome. So those are some of the great benefits of working with a doula. You have one person devoted to you who stays with you throughout the entire time of this incredibly intense birth experience. So just a little bit about pricing and range. People charge, like I said, it could be almost volunteer to a few $100s for the people who are getting certified. Although some will charge more because they have a lot of life experience and work experience, and maybe they've been an informal doula for years, but never got certified until now. There's a lot of different stories out there. So it can be a few $100s to $800 to $2,000 to a $4,000 doula to $7,000 to higher. So there's a whole wide range based on experience and other kind of certifications that the person may hold. Like you might have somebody who's a doula and a very experienced lactation counselor as well, who will be doing follow-up after, or as a licensed massage therapist or an RN. There's just different things. So think about, when you fill out our form, you can tell us approximate budget. You're not locked in at all. Start to meet different people and just see what feels right. You might find that somebody who is charging a little bit less has an amazing vibe and you love them and you really want to work with them. Or you might be like, I really have a lot of complications and I want a very experienced doula who has been at my hospital many times and who has navigated all sorts of complicated situations, right? So lots of different great options to talk with and just see, but it's all about fit. And I don't know a single doula who hasn't worked with a doula, because we just believe so much in, and I'm totally biased, so I get it. I have a doula company, so you do not need to listen to me, but doulas this is a very unknown thing if you've never done this before, and they take the pressure off of the partner to know every last thing. That's What I find is really incredible is that most partners have told me that the birth felt way more intimate than they ever imagined, because we free you of knowing every last thing. That you don't have to remember everything you learn in childbirth, but we also allow you to have, you can have the intensity of the experience of being with your partner going through this. Like I always say, people in labor want a lot of eye contact and hand holding and a lot of butt massage. It is very hard. I dare you to try and do that right now. Give butt massage and amazing eye contact. It's just hard. And so we find like it's a two-person thing in history. In almost all parts of the world, you never see, occasionally, but rare to see a birthing person be by themselves without support, usually lots of support. So think about it. It's something that I feel super passionate about. Obviously, I've dedicated my career to it, and can be very, very supportive and helpful. And please, we don't want finances to be something that means that you would not be able to have a doula. And so again, wide range of possibilities. Just tell us what you can do and we will try to work with you and support you in that. All right. Let's talk a little bit about lactation. I would love for you to, so from a lactation standpoint, let me grab a baby. One of the things that can really support you getting lactation off to the best start is having the baby in skin-to-skin contact right after birth. So ask your midwife or doctor now, if everything's fine with the baby, can I place my baby in skin-to-skin contact? If we do that and we wait and we give the baby time, babies actually have the ability to do, it's called the breast crawl, and they crawl up and they latch themselves on in the best way possible with the least amount of pain for most people. So a few things to know. One, lactation, breastfeeding, body feeding. I will use many different terms. Body feeding is the more inclusive term. So I'm going to use that as well. Some people call it chest feeding and some people call it breastfeeding. So when you are latching your baby on, it should not hurt. So that's going to be my first thing. Pain. And you'll see if you come to our lactation class, we have what's called complete lactation preparation class, which is a great class to really dive deep into why we have such problems and issues with lactation in America. Much harder for American birthing people actually than it is in much of the world. And a lot of that has to do with the birthing practices of this country. We tend to take babies off the chest if we don't ask, or if we don't say, hey, I'm going to keep my baby in skin-to-skin contact. So the American Academy of Pediatrics recommends skin-to-skin direct contact and leave the baby there as if everything's fine. That may not happen. Sometimes you have a situation where the baby needs extra special support or needs to go to the NICU, or you might need some extra care. So it does not always happen. And we certainly teach that that's okay. Your baby will still latch, all is not lost. We're just saying that one thing that can be really helpful is if everything is fine, the baby in skin-to-skin contact on your chest. And because they do this breast crawl, and they will tend to position themselves in such a way where they go nose to nipple, where they keep the mouth below, they lift up, and then they latch right into the right spot. So, in our class, we will do a lot where, I'm going to show you nose to nipple, chin mushed in, and you want to bring that baby right in. So there's a tip for you. Another tip is babies, when they're nursing, you do not want to try, let me lower this a little bit. You do not want to try stuffing your boob into the baby, which is one of the most common things that we do. It's okay. It's natural that we feel that we should do that, but the baby actually should come to you. And when you start going chin mushed in, bring the baby right into you, you start to see that the baby will get more, they can open their mouth wider, which is really important, and they can stuff more breast tissue into their mouth. So their mouth should be super wide open, super duper wide open, but they close it real quick. And so we got to get it all in there. So bringing the baby in. Other quick tip is if you're having pain while nursing, take the heel of your palm, press it into the shoulder blades, and that will allow the head to tip back slightly, which allows the mouth to adjust a little bit. So try that and see if that should reduce the pain. But if you're feeling extreme or significant or just general pain for more than, say, 30 to 60 seconds, if you can tolerate it 30 to 60 seconds in the first 2 weeks-ish, it should start to relieve. As long as after that 30 seconds, it releases, and you're like, oh, this is okay. But if you are feeling continuous pain throughout the entire latch, essentially you're setting yourself up to not make enough milk, to have potential infections, right? Mastitis, various things, because if there's a lot of pain while nursing, usually what's happening is this nipple here is getting mushed and mashed and flattened, and it's not supposed to be, right? The baby's mouth is supposed to be really wide open. When they nipple feed rather than breast or chest or body feed, nipple feeding is painful, but it also can cause fissures and cracks. And so you guys may have heard of cracked bleeding nipples. That is not normal, should not be. Cracked bleeding nipples means we have a latching issue. So again, Boober started originally because I wanted to help people with a lot of basics of lactation problems that we have that can be solved really early on. If we wait too long, creates all sorts of problems and lower milk supply and things. So I am going to let you know that we have an amazing group of lactation consultants and counselors on the platform, on the Boober platform. Many people are back to in-person care. Many people, depends what you prefer. If you prefer virtual care, some problems are fine on virtual. I was the last person. I was not ever going to go virtual. Did not believe in virtual care, to be quite honest. And then in the pandemic, obviously we needed to help our people no matter what. And so we turned to virtual care like everybody did. And incredibly, the feedback now, and now we've been doing it obviously over a year. The feedback is so powerful and so helpful. And some people had to absolutely go on and get in-person care, but very few. It was quite amazing how many people found that their latch could be solved through video. Amazing to me. So we're still keeping it, but we are also, of course, back to in-person in the area. Where for your friends who are wherever they are, please do let them know that Boober does exist nationally now, and we support people and we do classes all over. We do have some lactation consultants that are covered by insurance, and not that many, and I'll tell you why. It's a New York City problem, actually. It's a New York City area issue. So we do ask you to tell us what insurance you have, because we will certainly try to help you in that regard. Many of the local insurance companies block lactation consultants from being on it, so there's not enough people. Most insurance doesn't. The Affordable Care Act requires that lactation counseling be covered. That is a must. But so everybody provides a super bill to help you get reimbursed. And that's one of the things I am excited to do at Boober, is to solve and figure out how we can take insurance and make this much easier for all of you. As of right now, that you do have to pay upfront in most cases. Like if you have Aetna has very good lactation coverage. We do have a couple of people on Aetna on the platform, but some of the other companies, they might have one or two consultants only available. So you can ask for what's called a geographic gap exception. Let me give you our blog. Actually, I'll look up we do have an article about this on the blog. If you click into lactation, trying to help people navigate that whole thing. So it is possible that it's covered. It is probable that you should get reimbursed, but I'm not saying that your insurance company will be easy on you about that. And we will certainly do what we can do to help. Some of you can get pre-approved. So United Healthcare sometimes does. BCBS, Blue Cross Blue Shield, is pretty good at pre-approval, which means that you call us when you have the baby. You fill out the form for the lactation consultant. If you just go to our website, you'll see like what help do you need, and you click lactation consultant. And then you fill out the form, and then we'll text with you or call you back depending on what you want. And then we can match you to somebody if you absolutely want it to get pre-approved through insurance. It takes a little longer. We can't necessarily do same day matching because we have to wait for your insurance company to pre-approve the specific person. But as soon as you get pre-approval, then you can make that match. So we certainly do what we can to try and help and support you that way. Getting lactation support early, though, makes a huge difference, like I said, in terms of how long you may find yourself able to nurse. So the American Academy of Pediatrics recommends exclusive lactation for 6 months and beyond. But if they're not, we need to create a system that's going to help people to be able to do this, because if you're in pain and you can't get the help you need, and all of that can be much more challenging. So we do, want to support you, but also know, again, Boober meets you where you are. So maybe you're already doing some formula feeding, and maybe you are exclusively pumping or whatever you're doing, the people on the platform are, goals based, right? They're going to say, so what are your goals? Maybe your goal is to nurse exclusively. Well, then we're going to try to help you meet that goal. But maybe you've said, I'm already supplementing some, and my goal is to keep my milk supply from tanking further than it has, or whatever your issue is. And so we will work with you on whatever your goal is. But lactation support makes a huge difference. And so please, the bottom line is don't suffer. Know that pain means something's probably not right if it's continuing throughout the entire session of your nursing. If you're dreading nursing, your shoulders are up to your ears, you're crying, etc. That would make it really, really hard to keep going. So I'm going to give you this. These are all of our different classes. You'll see there's the complete class in there. I'm going to talk about postpartum doulas now. Oh, and I see we have a question about postpartum doulas. So what does a postpartum doula do? Thank you for asking that question. And can you use only one for postpartum and not birth? Yes. So postpartum doulas are different than the birth doula, and they only support you after. Some people are both a birth and postpartum doula, and some people are one or the other. So let me see, actually, if I can quickly find here. What is a postpartum doula and why do I need one? There's one. I'm going to give you a little article in case you want to read that. Postpartum doulas, I like to say we help ease the transition to parenthood. But we also, postpartum doulas are all about, they're like you care and baby care. Or I guess I often say baby care and you care, because we're not just devoted to the baby. My goal is to make sure that the baby is well and is cared for, but also that you are well and you are cared for. And what does that mean? That looks like a blend between, we help ease transition to parenthood in whatever way you need. So if I need to teach you about baby soothing techniques, right? I can talk to you about shushing and rocking or holding the baby. Babies love to be held actually like this if they're really fussy. What am I doing here? And you'll learn this more in our newborn care class. I'm not choking them. I'm putting the chin in the thumb and forefinger right there. So, and then babies, when you hold them on their belly or on their side, like so, you'll see that some fussy babies just will stop crying. They'll just dramatic. And so kind of bouncing, rocking, but also, or on the side, and then shh, right? I'm recreating the womb environment and I'm making the sounds that they're used to. So the shushing, and why people are always shushing babies, is because they're used to the inside of your body going whoosh, 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 whoosh. So that's a really great thing, to think about. And as a postpartum doula, I'm going to teach you different things. I'm going to help with diapering. I'm going to help you with nursing, the basics, right? As a postpartum doula, I'm going to make sure that you're fed. I'm caring for you. And if you don't feed yourself and if you don't sleep, you're not going to be it's not as easy to care for a baby. So I'm going to give you prescriptions like, the baby just went down, I want you to go lay down too. Let's set you up. Even if you don't take a nap, let's get you laying down in the bed and let me get you some comfy, cozy tea or whatever, if it's hot out, maybe not, and get you calm. Let's put on some music, because sometimes you can feel like, I don't know if I can sleep. And I'll help you kind of do that. But sleeping is so critical. And, not sleeping is something that puts us at risk of postpartum depression or anxiety. And, yes, you're going to be waking up a lot with a baby. That's perfectly normal. But postpartum care makes a huge difference. Nobody historically ever did this alone. And that's why I'm going to really urge you to think about hiring a postpartum doula, or I'm going to answer your question about the night nurse, Erin, or having your family members. Again, we're in a different situation now than we were some months ago, where you may feel comfortable. Not all people do, but you may feel more comfortable, especially with vaccinations, et cetera, of people coming into your home and caring for you. So you really want to start thinking about your postpartum care plan. I'm going to also give you, let me put in with postpartum doulas, or postpartum care planning. Oh, that's what I was, sorry. I'm thinking about our postpartum support class, which is great, the postpartum prep class. So in our postpartum prep class, I will really talk a lot more about what family members are coming. How do you figure this out? Figuring out whether you're going to do a night nurse or a postpartum doula. But whatever you do, like having help, whether that's friends coming, dropping food off for you or helping in some way. We were never meant to do this alone. And the postpartum doula can really make a difference in those first few weeks when you're waking up literally every 1 to 3 hours. You're sleeping in chunks of like 45 minutes to 3 hours. That's totally healthy for a baby and normal, and they need to wake up really frequently. So you want to sleep when the baby sleeps as much as possible. That also really helps avoid, like I said, postpartum depression and anxiety, which can come up anytime in the first year, often peaks around 3 months if it's going to happen. We launched our mental health support in right at the beginning of the pandemic, because you can imagine how much anxiety there was as we all had, whether pregnant or not. But we had always known we wanted to make sure that we could easily find therapists who specifically work with pregnant and postpartum people. The biggest predictor of mental health issues or postpartum depression or anxiety is if you have already experienced depression and anxiety in your life. So if you know that, then it might be a great time now while you're pregnant to reach out to your therapist. If you haven't, just to have like a touch base, or just to know that we are here and can match you to somebody if you do find that you need the extra support. I think for anybody going through the transition of having a baby, you might find that talking to somebody once is really helpful, even after you have a baby, for dads, for partners as well. And postpartum depression and anxiety are really quite treatable if you tell somebody that you are experiencing some of those potential symptoms where you just don't feel like yourself. But anxiety really develops when we're sleeping less than 5 hours total per 24 hours. So I'm going to deeply encourage you 1 to 2 times per day during the daytime hours, when your baby sleeps the most, is when you need to catch your naps. And that's why having help to do dishes or laundry or anything, you should be doing none of that, but caring for your baby and having people care for you. So yes, Savvy, I'm going to actually give you a specific link to the class. I just need to pull that up as well. So I'm going to do that in a little bit and give you that link. In terms of the difference between a night nurse and it's going to take me a moment to pull up that code. I'm sorry. I didn't have it prepared. I thought I had it, but I need to look for it real quick. For sure, Savvy. But yes, the code for 30% off is off any class that we offer, and that will be good until midnight tonight. I am also giving all of you the code WELCOME is good 10% off off your first service. Let me just give that to you now. That's off your first Boober service. So if you want to book a birth doula with us, you can tell them code WELCOME. And that will, nice general code. I should give you guys WELCOME PSP. It'd be great if you tell them that you came from Park Slope Parents. All right. So what was I going to talk to you about? Nurses and night nurses. And I didn't give you guys the code yet. Code is coming. I need to look it up. I'm so sorry. I thought I had it right here. It's going to take me a minute, so I don't want to bore you with that. So I'm going to give you a special link in just a moment. All right. So in terms of baby nurses and postpartum doulas, the difference to me, baby nurses are more for babies, in my experience, not always, but they tend to be all about caring for the baby, rather than doing kind of what does the whole family need, right? So whereas the postpartum doula will do some cooking for you, will help you heal your perineum. So we'll make suggestions for a very sore vagina, or cesarean wound care, or mental health support, or just really deep listening to your birth story. We're very, very attuned to that, and we have counseling training skills as postpartum doulas. The baby nurse does tend to be more just about the baby, and they're often a little more focused on a schedule. They don't always have training in lactation. So those of you who do want to breastfeed or body feed, I highly encourage you, if you're hiring a baby nurse, make sure that they are supportive of that they're not necessarily just giving very, very early bottles so that you can sleep at night, which sounds amazing. And it's totally fine if that's what your plan is. But because the way breastfeeding or body feeding works is more milk out means more milk made, you need to feed every 1 to 3 hours or so. We need to keep extracting milk in order to keep our milk production up, which is why if somebody's feeding your baby overnight for you with a bottle, without a clinical reason to do so, just, because you want to sleep, which is amazing. I mean, of course you want to sleep. It's just not how the lactation system works. And so if that's happening in the very early days, you need to know that you may not make a full milk supply, which is fine if that's your goal. If your goal is to make a full milk supply, then if you do work with a baby nurse, you want to make sure that they are helping you to nurse. They're bringing the baby to you and you're nursing your baby all through the night. And then they're doing everything else for you. Baby nurses tend to live in. They tend to do a minimum of 2 weeks. They tend to do, either 12-hour shifts or 24s. And that's kind of the difference. Plenty of postpartum doulas do overnights as well. We have lots of people who do overnights, but we find that parents using postpartum doulas don't tend to necessarily, they occasionally do weeks of overnights, but more commonly they'll do catch-up nights. So you might be like, oh, I just need a few nights of overnight care to catch back up, or they like overnights in the beginning, but not necessarily like a live-in person. So that's somewhat of the difference. We also do, I'll just give you a little article on difference between baby nurse and postpartum doula as well. Pull that up for you guys. I think that we have that. Okay, I will pull that up in a minute as well. Any other questions so far? There we go. Okay. This is our article on postpartum doulas. And so give me 1 second. I want to get you guys the quote. Not the quote, the code. Let me see if I can find it real quick. I hope she sent it to me. Ah, here it is. Okay. Thank you for bearing with me. Okay. So if you, right now, you should be able to click into that link that says PSP 30. And that should give, if you scroll down, you'll see all future classes that we have. And it has a cross out so that you can see your specific price. All right. And that is good through tonight. Let me look at the questions. All right. How do we think about how much support we need postpartum? So that's a great question. Do you have any friends or family coming? Like, I guess I would start with that, right? In general, if not, or you're really wanting professional support. I like to think so. Postpartum doula is one way. They're also different from baby nurses is we can do shorter visits, like usually a minimum of 4 hours if you're doing in person. Some people have 3-hour minimums. It depends on the person. You can also, with us at Boober, if you don't want to book in advance, you can certainly just reach out to us on the day or, a couple of days before and say, like, I want to try a postpartum doula out. Then you can try a 4-hour shift, see if you like that person. And if it's a great fit, just have them come back. If not, then you try something different. I like to recommend that people book around, if you're into the 4-hour day concept, around 20 hours can be nice because you could have somebody come in kind of every day for the first 5 days, 4 hours, and then see how that goes. Some people, I've definitely been hired by people who thought they just needed a little, and then they were like, oh my God, can you stay more? And I end up working a lot more. I've also had people who are really like having enough family support that they just want a little professional guidance, where they wanted somebody who could teach them the basics of baby care, could, really work on lactation with them a little bit, but didn't need too much. So I've definitely had people, only book around 8 hours but I find that 20 to 30 hours is a great idea. In terms of CPR, you definitely, ideally, you want to take infant. We have an amazing infant CPR class, which comes in 2 different formats. One is 1 hour webinar style, where the teacher you can chat like this. The other one is 2 hours, and it's live interactive virtual. But like I said, I think a lot of you, I got a lot of IRLs here. So I would love to hear those of you who are like, no way. I also just, we're definitely keeping the virtual. So, but there's another vote for IRL. All right, it's coming, I swear. Outdoors. I know we wanted to try one in the park, but we were concerned because you can't really reserve a spot, and concerned about sunlight and being near bathrooms and whether that would work or not. If we book a class tonight that is virtual, is there a way to do it in person? Yes. If that option gets offered later, yes. I'm not sure that it will happen before this summer, although I'm getting a lot more feedback that people would come. So, but yes, we'll transfer that, sure. And Emily, I see you tried to sign up for the coping visualization class, but there weren't any listed for June. I think we alternate that. Let me, also some of our classes, we now have it as downloadable. That's one that's going to be online soon, where you could just download it and take it, Emily. So if you check back, that may go up soon as well. Okay. And you can, let me give you guys, I'll give you my email, jada@getboober. You may also see me in the neighborhood. If you do, feel free to say hi. Also, by the way, since I'm talking to Park Slope parents people, we were opening a small boutique a few months before the pandemic. So we have all the stuff, and then we did not, obviously it just didn't make a lot of sense. So I still have a ton of things that I would like to also get rid of at maybe around 30%, at least everything's at least 30% off. I have a ton of amazing baby carriers. I'm just going to show you this real quick. For instance, things like this, right? Which is awesome to carry your baby. You do like this. I have several different colored carriers. That's my favorite. That's what I always wore my daughter in. So I have all those. Anyway, I'm in the South Slope, so we'll do the follow-up email, but we have those. I have some Haka pumps. I have some amazing nursing shirts by Loyal Hana. I have diapers by Assembly, which are awesome. I'm going to show you guys also, we have a products we love page on our resources page. So I'm going to give you a link for this in case you are confused and overwhelmed by all of the things to buy out there, right? But you'll see, and most of the stuff that I have is, I don't even list it on Boober because I'm not shipping it. But if you're in the neighborhood or in Brooklyn and you would like to see, I can email any of you a link to all of the stuff that we have if you're in the baby buying things. So what else? Any other questions for me right now? So I gave you guys that code. You also, like I said, if you book a birth doula through us, we will give you that additional $45 credit on classes. So if you buy classes tonight and then you book a birth doula, we will either credit you or refund you or credit you. You can book as many classes as you like. Yes. So yes, the 30% off is for tonight only if you book by midnight. And it is special for Park Slope parents. We rarely give a code that is that high. So I would love, yes. And the welcome code, yes, you can use that. Welcome is just for you to 10% off your first service. So whether that's booking a birth doula or you don't need us and maybe you have a lactation issue, you can use it then. Yes, so that's your first service, even if you use the classes. Like Park Slope is my, my home and my place. And I want people to know that we are still here, even though Birthday Presents to Space is not here right now. We're coming back. Hopefully we will find space. It sounds like you're all looking to be in space. We believe deeply in creating community and connection. So I'm talking with Park Slope parents actually about, maybe we'll do an outdoor event this this summer sometime, just so hopefully you guys are all able to meet with each other. I highly encourage that. Somebody asked, what did you ask about? A class? Oh, it was there. Oh, if there's one course to do, which would it be? The childbirth class, probably. I mean, I love the 4 2-hour session. To me is wonderful. It's much deeper. You get time to think about things. You get time to ask questions. You get time to practice. I know that we are so zoomed out, so maybe it will be back in person in time for your due date, but I'm not positive, and we're not going to be able to start in a huge way, right? But it's a great class. The people really, even online, like they really talk to each other and connect. I think it's a nice way to, the 3-hour also is great. I mean, you will get a solid overview. And then if you drop into the $15 like pain coping classes, that can be a great supplement to the 3-hour class, I would say, so that you have time to do some practice. We're working on a downloadable class that you can take on your own time. I'm curious if people are interested in that. Are you more likely, would you rather come to a real class? Or would you rather, I shouldn't say a real class, but a live class, whether that's in person or here. And I'm also just launching a quick poll actually to see what else you guys are into, because we also do my prep for postpartum class. Is great. I think that's a very affordable drop-in class as well. The pelvic floor health class that we're about to put up a new date for it. So it's not up just yet. But I am curious. It helps us know what kind of things you guys are interested in if you take this. Pediatrician, any questions you recommend asking? Yes, I would recommend asking. Well, I'd first say, you want them to be nearby you because you go so often. So that's one thing, is proximity. I would ask if you're planning to breastfeed or body feed, then you'd want to know, what kind of, are you supportive? I mean, they should be, but like, how can you help me if I'm having any lactation issues? Are you familiar, right? Like that could be something I would ask. When, are you doing all in person? When do you need me to come in? Can I call you anytime? You want to feel very comfortable being able to call your pediatrician anytime. If you have any vaccination questions about timing of vaccines, some people some care providers follow the AAP guidelines exactly. Some pediatricians allow a little flexibility in spacing of timing of vaccinations. So that's something that people will ask a question about as well. Those are good questions, but I would say primarily, to be quite honest, you have to go so often that you do want them to be nearby and accessible to you if that's possible. Yeah. And then, what I would say, my last thing about the pediatrician, you can change. Don't be afraid to, change positions, because I just said change positions, change pediatricians, get a vibe. If they're really inaccessible, they don't call you back, they're hard to communicate with, or they're giving you bad information that doesn't, and when I say bad information, what I mean is it conflicts with your gut instinct about your child. Like, so when I say bad information, sometimes it will be, you may be told, certain pediatricians will maybe say something like, you don't need to feed your baby overnight after 8 weeks. Just let them cry. That would be something that's not totally accurate to allowing our ongoing lactation relationship. So advice like that will often cause our milk supply to dip, because it is normal for babies at 8 weeks to continue to nurse through the night. So that might jive with you, or it might not. I definitely have parents who will come to me and be like, oh my God, they told me I should do this, but that doesn't make sense. My baby's still waking up 3 times to feed. Is that normal? I'm like, yeah, totally normal. Right. Well, the baby can survive, sure, if they didn't feed all night, but that's not what your baby's wanting to do right now. So if you're getting information like that doesn't jive with what you feel, if it jives, fine, then you can change. And I would encourage you to change, because the pediatrician relationship is a very long one, right? I'm still, I met my pediatrician, my daughter's 13. So you want to really like that person. Other questions for me? Well, I hope that I don't want to keep you too much longer. Thank you, everybody. I hope that this was helpful for you. I hope that you know that I'm a resource to this community, and you can always reach out. Oh, sure, Evan. So happy. I miss seeing you guys all in person. Normally, we used to host all of the Park Slope parent events in our space. And so I would have met all of you and seen you all. We want to be a resource to you. You know, let your friends know about Boober, please. We appreciate that. Oh yeah, you cannot copy and paste. I don't know why. That's so annoying, right? You have to, can you click on the link, Erica? If you click directly on the link right now, it'll open for you. I have no idea why you cannot copy and paste. So just click it and let it open in a new browser. Oh, I'm glad, Kim. You know, anything. And like, if you guys have suggestions for us, feedback, just email me. You have all of the info. All right. Take good care. I will see you soon. Oh, Savi, I'm so glad. That's so sweet. I'm gonna like photograph that. Yeah, you're welcome. Oops. Night.